Welcome to CNS Focus series of interviews from 12th Asia Pacific Conference on Tobacco or Health from Bali, Indonesia. Tobacco kills nearly 7 million people every year, of which 1 million are non-smokers who die due to exposure to secondhand smoke. Majority of tobacco-related death and disease can be prevented if countries implement strong tobacco control policies and measures as outlined in the World Health Organization's Global Tobacco Treaty, formerly known as Framework Convention on Tobacco Control, which has been ratified by 181 countries as of now. Today, we are in conversation with a noted expert, Dr. Indu Ahluwalia, who heads Global Tobacco Control Branch at USA's Center of Disease Control and Prevention. So, without any further ado, let us get the valuable insight from Dr. Ahluwalia on how tools like monitoring and surveillance can help tobacco control measures. Welcome, Dr. Ahluwalia, for joining us today. Can you just tell us how grave is the problem of tobacco use in this Asia Pacific region?
Thank you, Rahul, for having me. It's a pleasure to be here. As you stated, in this century, we will have approximately 1 billion people die from causes related to tobacco. And we know the burden of tobacco use is huge, particularly in low and middle income countries. And one of the things that we want to convey is that Asia Pacific region has many countries with large populations, and we do see higher rates of tobacco use. For example, in China, 1 out of 3 cigarettes smoked is among Chinese citizens. So that's one of the countries quite impacted, and we know that others are as well. And we also know that Asia Pacific region is not only known for combustible tobacco use, but also for smokeless tobacco use. We know that 90% of the global smokeless tobacco use is consumed in the countries in the Asian Pacific regions. 2 countries that come to mind are India and Bangladesh, for example. So the burden is quite large, and I think we have a lot of work to do in this region to control tobacco use, both combustible and smokeless.
Why is the global tobacco surveillance system important for help enhance global capacity for tobacco prevention and control?
The Global Tobacco Surveillance System, or GTSS is what we call it affectionately, is the largest public health surveillance system in the world, and it is composed of 3 surveys. We do surveys among youth to really find out what's happening in terms of the youth use, their exposure to advertisements and other things. And then we also have what we affectionately call GATS, Global Adult Tobacco Surveys, which are surveys, population-based surveys around the globe of adults 15 years of age or older. And we also have what we call Tobacco Questions for Surveys, or TQS, which is a standardized set of questions that countries can use. So, one could ask, what is the importance of these surveys? Why do we care? And I think one of the things we have to recognize is that data tell a story. They tell a story about tobacco use. They allow us to measure what's happening. And one of the most important things you can do is to have consistent, credible data. And our Global Tobacco Surveillance System allows countries to implement the surveys that are standardized, that are able to measure not only tobacco burden, but what are some of the solutions that countries might need to enact. The data are there to strengthen tobacco control efforts. It is to provide evidence for countries to recognize what is working and to pave the path forward towards tobacco control. We know without data we're groping in the dark, so you need to have credible evidence. And one of the things that GTSS does is it allows countries to have standardized data that they can look across time. So if they do surveys more than once, they have credible data that are comparable, standardized, and also these data are comparable across countries. So we can compare data from country A to country B because it's collected at the same standardized way, applied methods.
How this data has helped the governments, particularly in Asia Pacific regions, to develop successful tobacco control policies and and also prioritize appropriate tobacco control measures for tobacco control interventions. Please give some specific examples.
So, as I mentioned, the GTSS collects data in cooperation and collaboration with the governments, particularly the ministries of health, their statistical programs, as well as international partners. Otherwise, we want lots of partners to be able to use the data, so that it's in a collaboration with a number of interests within the country as well as globally. In terms of how the data have assisted countries, we know we have some really good examples from Asia Pacific region. India, for example, recently released their data for the second wave of GATS. They had done their first GATS in 2009, 2010, and they just finished releasing their second wave of GAT, which was 2016, 2017. And what they found was not only their combustible tobacco use rates had gone down, but also their smokeless tobacco rates had gone down. And one of the attributions that India is able to make towards seeing these differences is some of the national legislation that was passed in 2011, I believe, the gutka bans. Because the thinking was, you pass a law that is reducing smokeless tobacco, but we see an increase in combustible. And the story there is very interesting because we saw a decline in both. And so there's a lot to celebrate. And India is a really good example as well because they have more granular data from GATT surveys. So they can actually look at they can look at more geographic granularity about tobacco use and what is happening. There are a couple of other examples that show the countries using the GATS data to have very concerted campaigns that they can evaluate. Philippines was another example. They did multiple waves of data. And what was clear from the Philippines data also, it's a slightly different example, is that they saw a huge rate of increase in people wanting cessation services. So that helps the country to address the service needs and to develop programs that can really speak to what people are needing. We also have couple of other places where they have collected GYTS data, which is our youth tobacco, multiple waves of GYTS data, and again Philippines and Sri Lanka come to mind because what they've been able to do with our youth tobacco data are that working to mobilize their pediatric providers to protect children from harms of secondhand tobacco, and we're really excited to have that collaboration with the pediatric societies in both of those countries to assure that data are used in a meaningful way.
So, do you think these data have also helped the tobacco industry similarly to come up with the newer tactics and newer products to attract their customers?
Well, we know the tobacco industry has a long history of actively promoting new products to their various groups, particularly vulnerable groups. They have an extensive research of their own to inform their products and services that they're selling. What's interesting to us is in recent years we see that the tobacco landscape has changed. We have, as you heard this morning, there are lots of new products are being introduced into the market, and they're appealing particularly to younger audiences. We're thinking about things like electronic cigarettes and heated tobacco products. So we see that landscape is changing quite rapidly, and it's a global phenomenon. And what's clear to us is in this diversifying landscape for tobacco, we need to modernize our interventions. We also need to respond to make sure that our surveillance systems are also nimble and able to adapt to these changes and to be able to inform the public health policy so we know what are the trends in data, what are the new products that are being used by our populations. So GTSS plays a critical role in that process. So the bottom line for us is that it's important to be nimble in the landscape. To be evolving with the changing landscape of product availability. and also to come up with effective models for interventions, and to assure that data are timely and are able to inform what is happening in the population. So we're very excited to say that GATS data do allow countries to capture these changes, particularly as the uptake of new products is being promoted, and these patterns can really inform both the policy within the country as well as any practices that the countries wish to enact for tobacco control. So I do think that our data are very relevant in the changing landscape.
What measurable shifts have occurred in the last 5 years regarding the pattern of tobacco consumption?
So we know that alternative tobacco products have entered the market globally full force, and there's been a lot of discussion about the marketing of e-cigarettes, for example, as well as heat no burn tobacco products. And what's interesting is when you look at the vaping market globally, we do see it's expected to be increasing to I think 55 million users by 2021, a remarkable increase from 2011 where we saw maybe 7 million users. So it's a huge growth that's expected. And one of the things is it's billions. The growth speaks to billions of dollars that are being spent on alternative products. And when we think about the markets in these areas, 2 countries in Asia Pacific are among the top 10 spenders, and that includes China and India. So we know that the landscape is changing. We have to be able to measure the scope, the depth, and uptake of these products, and surveillance, of course, plays a critical role in being able to see what is happening in the population. And we know that e-cigarettes are now available in the Asian Pacific region, and the heated products are also known as heat not burn, are increasingly becoming available. So it's an evolving landscape, and the data that we get from our systems will inform the programs and policies in particular, and implementation of tobacco control measures.
Also, the smokeless form of tobacco is very prevalent and common in some countries of this region, and or even though they are equally harmful. So, what is being done to curb such?
Well, there's several, proven population level strategies that can be used to reduce tobacco use, including smokeless tobacco. And countries in the Asia Pacific region have taken measurable actions, and I will give you a couple of examples. Again, I will go back to the India example, which in 2011 enacted a gutka ban, and that had quite a measurable impact in terms of when you look at the GATS data over 2 waves. What we found is that there was a substantial decrease in not only combustible but also smokeless tobacco. And of course, as we talked about earlier, it'll be interesting to see how the different states level activities have taken, because states have taken on the gutka bans and strengthened them in some capacity. So and the GATS data, we do have GATS data from both waves that they can use for measuring their progress. Other example really are countries that have prohibited smokeless tobacco. And then my third example is the Bangladesh, which recently released their second wave of GATS data. And they're an interesting example because what they had, their initial GATS data was in 2009, and they completed their second wave in 2017. And in between, about 2016, they started to have graphic health warnings on their smokeless tobacco packs. And what the data showed for the second wave was there was increase in people knowing about the dangers, and they had seen the graphic warnings. So that speaks to the value of having data that can speak your truth, what is going on. And I think those are a couple of really good examples of countries in the Asia Pacific region that have done something very strong about tobacco, smokeless tobacco.
Or what message would you like to give to people from this APAC 2018?
So I think one of the things that I was so excited to see the young youth movement. Youth are not only here as observers, but they're here as full participants. To me, that's really exciting because I think that the youth are just a resource as well as a movement that's going to make a big impact. So my message to the conference attendees is to keep your eyes open, keep the eye on the prize, which is tobacco control, and make sure you measure, because at the end of the day, what gets measured gets done. So my message to everyone is keep up the strong effort in tobacco control, and I think all of us can make a tobacco-free generation a reality.
Thank you so much, Dr. Ahluwalia. Friends, we were listening Dr. Indu Ahluwalia, Chief of Global Tobacco Control Branch at USA's Center of Disease Control and Prevention. For more updates, please be welcome to visit CNS website www.citizen-news.org.